The world is bigger and smaller than we think. We can cross the oceans in a matter of hours, in large numbers and confined spaces. In our cities, we cross paths with others often, and we're not just exposed to other people, we're also exposed to the risk of a pandemic. An unknown new and potentially deadly virus is discovered offshore. Health Canada has issued a protocol to authorize Transport Canada to trace movement from the infected region into Canada on all international flights. An international flight is about to arrive in Vancouver because it originated from a country that has been identified as a potential source of a new, unknown virus. The manifest containing basic contact information of all passengers and crew has been added to a new epidemic tracing system prior to the plane landing in Canada. None of the passengers show any unusual health symptoms. Some passengers disembark and move into the Vancouver community. Others continue on with the flight to other Canadian cities, including Edmonton, Toronto, and Montreal, which the flight crew calls home. The new tracing system is called EpiTrace Sentinel, designed to augment, not replace, human intelligence. Public health personnel are provided with real-time global event tracing and mapping, intended to provide early warning by securely locating and mapping interconnected and intersecting contacts to help protect people and communities. Contacts in the system are represented anonymously by colored icons, with each color indicating a category of infection status. Green indicates possible infection. Blue indicates probable infection. Red indicates confirmed infection. Only authorized users are provided with access to any personally identifying information associated with the contact records, maintaining privacy. A virus doesn't recognize arbitrary geographical boundaries, so the system is likewise not geographically restricted. By selecting any global location through the EpiTrace Sentinel monitor, the user is able to focus on any region of interest. EpiTrace Sentinel can search for interconnects between any number of individuals or contacts by user-defined geographical location, with selectable search radius, updating its real-time data as frequently as every 10 seconds. Backdated in time. This provides widespread, easy-to-use, privacy-centric, secure contact tracing. Showing the same data from different temporal and spatial points of view can enhance the efforts of public health personnel in understanding how the virus may actually spread. Our travelers from the original flight have now dispersed into their respective communities. At regional public health centers, personnel have been alerted by messages from Health Canada to be on the lookout for any unusual medical symptoms that may appear in the population. As a precautionary measure, public health centers utilizing or having access to EpiTrace Sentinel initiate a search, discovering a cluster of previously unknown possible cases represented by green-colored icons. Further investigation of each contact record by authorized personnel discloses that the reason for this classification of possible status was their collective arrival in Canada on an international flight from a country with a known outbreak. Similar previously unknown clusters are observed in Vancouver, Toronto, and Montreal. One of the contacts in Edmonton develops symptoms and seeks medical advice through Alberta's HealthLink 811 system, resulting in identification and recording of suspicious symptoms. The contact information is relayed to the regional centre, and the record is opened in EpiTrace Sentinel by an authorized public health system administrator to be updated. Only authorized users with appropriate credentials are able to access the personally identifying information in the system. The contact's medical case status is changed from possible to probable. Notes are added about the individual being tested for COVID-19. The results of such testing can take days to be returned. This potential lag time could prove fatal with regards to identifying and locating other infected contacts. EpiTrace Sentinel provides the following capabilities, among others. Displaying an alert indicator on all maps in the country in all regional health centers utilizing the system. Computer monitors are filled with multiple identified contacts and their contact locations, where the alert is elevated automatically as a change in color from green icons to blue icons on the map, as record statuses change from possible to probable. In EpiTrace Sentinel, this is called an early warning flare. The system can trigger a call list of all known and identified contacts that can be contacted by health authorities at each regional location. This system enables health authorities to dispatch contact tracing personnel with mobile devices to interview high-risk individuals in a structured manner, to identify and capture, backwards in time, the interviewed contact's movement history over the time period defined by the protocol. Open-source SQL design allows for data exchange with existing sources and systems, enabling advanced analysis and potential for business integration. EpiTrace can provide real-time visual representation of case data in the form of charts, graphs, and dashboards. The backtrace feature for all probable cases becomes critical in connecting known contacts with what later may appear as a community outbreak. By assessing these contact vectors back in time and location, the system helps public health professionals predict and potentially mitigate a possible outbreak before it happens. As an example, because EpiTrace Sentinel is a regional but interconnected distributed network of systems, Vancouver is alerted to the risk in their region and then initiates a response to its own early warning flare. In Vancouver, this backtracing of one of the local probable contacts identifies a critical intersection. The contact had visited his mother in Little Rock nursing home 2 days after landing at the airport, and 4 days into the tracing cycle. Even though test results for the son may be delayed, and he may or may not test positive, health authorities can now escalate protocols that may save his mother as well as other vulnerable residents of the nursing home. 10 days later, test results on the original probable contact come back positive, and the contact record is updated by an authorized user. To confirmed status. The individual is quarantined or admitted to hospital for medical care. The individual contact icon in EpiTrace Sentinel is seen changing to red on the regional map. The remainder of the probable contacts remain blue until such time as they are downgraded or upgraded according to clinical test findings. Only authorized public health system users can change the case status to confirmed. All across the country, EpiTrace Sentinel alerted public health personnel in this example, at the earliest possible opportunity by eliminating potential delays in receiving test results, while at the same time locating and mapping interconnected contacts across arbitrary boundaries and identifying potential hotspots. By recording and tracing movement and location, medical status and contacts of infected and/or high-risk persons, while maintaining privacy, the system traces and can assist in predicting locations of outbreaks across the country. Through regionally distributed interconnected systems and networks, EpiTrace Sentinel scales easily and is capable of handling an unlimited number of data input sources in the event of a massive pandemic. Extensions to the system are in development to interface with smartphones, additional mobile apps, and wearable tracing technology. In the hands of dedicated public professionals, EpiTrace Sentinel can be instrumental in helping protect people and communities that otherwise may run the risk of being decimated by the silent and asymptomatic spread of a deadly virus. EpiTrace Sentinel's singular mission is to help save lives.